Hi everyone, I chose osteoarthritis for my flashcard topic this week. It's also referred to as degenerative joint disease, meaning that it's a progressive disease. The pathophysiology behind OA is damaged cartilage is found in joint spaces due to structural fissures and erosion that's typically in the setting of excessive stress. The cartilage and bones of the affected joints become eroded and mobility is reduced. The joint space then becomes thinner and results in surrounding secondary tissue inflammation. The affected tissues then release enzymes that worsen cartilage damage and eventually leads to exposure or damage of the subchondral bone, as well as the formation of cysts and or osteophytes or bone spurs, which are basically just new growths of bone. Osteophyte and cartilage fragments break off into the synovial cavity, leading to more tissue damage. The most common joints affected are typically the hands, knees, hips, and spine. Risk factors for OA include age. Increasing age is probably the main risk factor. Gender, for some reason, females are more likely to develop OA. Obesity, the extra weight on a person's joints adds extra stress. Previous joint injuries, repeated stress on joints, whether this is through somebody's job, people that work with heavy machinery, or, a lot of us nurses are at risk of developing OA. Genetics, bone malformations, or cartilage deformations, metabolic diseases such as diabetes and hemochromatosis can also increase your risk. Major signs and symptoms of OA include pain, stiffness, tenderness, swelling, limited flexibility, and crepitus in the affected joints. Patients will complain of cracking or popping, feeling in the joints, bone spurs, muscular atrophy in older adults leading to falls. This picture is essentially showing the difference between a normal knee and an arthritic knee. And I chose the X-ray image because this is one form of diagnostic testing, and I think it's important for us to become familiar with what that looks like. Obviously, in the first picture on the left, you can see a normal joint space, and then it's reduced in the arthritic knee. You can also visualize a little osteophyte, and also some sclerosis, which again is reflecting that tissue damage. So other diagnostic testing aside from X-ray, X-rays actually, they don't show the tissue inflammation or even the cartilage, but you can actually see the reduction of that space. And MRIs can actually help us to visualize that cartilage more so, and then of course it's just a better image overall. Blood tests and fluid analysis to rule out other causes, such as rheumatoid arthritis, or if there's an infection in the joint and that's what's causing a fluid buildup. So sometimes they'll do they'll aspirate the fluid and just send it for sensitivity and culture to make sure that it's not an infected joint. And that's it. Thanks for watching.